Welcome to Introduction to Healthcare and Public Health in the U.S. Meaningful Use. This is Lecture A. This component, Introduction to Healthcare and Public Health in the U.S., is a survey of how healthcare and public health are organized and how services are delivered in the U.S. It covers public policy, relevant organizations and their interrelationships, professional roles, legal and regulatory issues, and payment systems. It also addresses health reform initiatives in the U.S. The objectives for this unit, Meaningful Use, are to define meaningful use, or MU, of health information technology in the context of the Health Information Technology for Economic and Clinical Health, or HITECH Act. Describe the major goals of meaningful use. Discuss the criteria for stages 1 through 3 of meaningful use for eligible professionals, eligible hospitals, and critical access hospitals. Describe the standards specified for meaningful use, and discuss the likely evolution of the Meaningful Use program. In this lecture, we begin our discussion of the HITECH Act. The HITECH Act was part of the American Recovery and Reinvestment Act, or ARRA. ARRA was the economic stimulus legislation passed as one of the first acts of the presidency of Barack Obama. The HITECH Act provided up to $27 billion in incentives for the meaningful use of the electronic health record, or EHR, by physicians and other healthcare professionals, as well as hospitals. In addition, HITECH included direct grants administered by federal agencies and enhancements to the privacy law called the Health Insurance Portability and Accountability Act, or HIPAA. Although meaningful use consists of specific criteria that must be achieved to obtain the incentive funding available under the HITECH Act, the meaningful use criteria are driven by underlying goals for the healthcare system. The notion of meaningful use as a concept originated in legislation sponsored by Representative Rodney Pete Stark. This legislation was not passed when it was originally introduced in 2008, but was then incorporated into the ARRA legislation of 2010. The idea is that all meaningful use criteria must map to one or more of 5 goals for the healthcare system. These goals are improving quality, safety, and efficiency, engaging patients in their care, increasing coordination of care, improving the health status of the population, and ensuring privacy and security. Some examples of meaningful use criteria and their mapping to the 5 goals for the healthcare system follow. Implementing drug-to-drug interaction checks is a criterion that maps to the goal of improving quality, safety, and efficiency. Likewise, providing a summary of care to patients maps to the goal of engaging patients in their care. The overall requirements for meaningful use that come from the HITECH Act are that to obtain funding, the eligible professional or hospital must use certified EHR technology in a meaningful manner. They must use certified EHR technology connected in a manner that provides for health information exchange, and they must also use certified EHR technology to submit information on clinical quality measures. The overall plan for implementing meaningful use was that it would be done in 3 stages, all as part of health IT-enabled healthcare reform. Stage 1 would focus on the capturing and sharing of data, and we'll see that from the criteria. Stage 2 would focus on advanced care processes with decision support, while the goal of Stage 3 will be to focus on improved outcomes. The details of Stage 3 have not yet been finalized. A qualified EHR is one that is able to carry out the functions required for meaningful use. In other words, an electronic record of health-related information about an individual that includes patient demographic and clinical health information, such as medical history and problem lists. A qualified EHR also has the capacity to provide clinical decision support physician or provider order entry, capture and query information relevant to healthcare quality, and exchange electronic health information with and integrate such information from other information sources. The Meaningful Use program provides reimbursement to eligible professionals, or EPs, and eligible hospitals, or EHs, through the Medicare and Medicaid programs. Each program has slightly different rules. Under Medicare, eligible professionals include MDs, DOs, dentists, podiatrists, optometrists, and chiropractors. Under Medicaid, the list of eligible professionals is expanded to include certified nurse midwives, nurse practitioners, and physician assistants operating in certain healthcare environments. One thing to note is that while hospital-based professionals, such as physicians who perform more than 90% of their service in a hospital, are not eligible for funding under the Eligible Professionals Program, the organizations they work for are eligible for funding under the Eligible Hospitals Program. Eligible hospitals include acute care hospitals, which are the majority of hospitals in the United States, as well as critical access hospitals that provide care in mainly rural areas under Medicaid. Children's hospitals are also included. Unlike eligible professionals who are eligible anywhere in the territories of the United States, the Eligible Hospitals Program is available only to hospitals within the 50 states and the District of Columbia. There are various other differences in whether the incentive funding is provided through Medicare or Medicaid in terms of the amount reimbursed, the rules, and some other aspects. The table on this slide shows the payment plan for eligible professionals paid under Medicare. The rows of the table indicate the calendar year of the payment being made. The columns of the table indicate when the incentive payment started after meaningful use was achieved. For those EPs who started in the very first year, 2011, they received $18,000 the first year and $12,000 the second year, then $8,000, $4,000, and $2,000 for a total of $44,000, which is the maximum. EPs starting in 2012 were also able to receive the maximum. Those EPs who started later in 2013 and in 2014 were not able to receive the full $44,000 but still received some incentive payments. However, starting in 2015, EPs who did not meet the meaningful use criteria started to be penalized at 1% per year and increasing another 1% each year up to a 5% total. Eligible professionals who were paid under Medicare and were practicing in health professional shortage areas received a 10% boost. In other words, they could have received up to an additional $4,400 or as much as $48,400 in total. The payment of eligible professionals under Medicaid is different. These individuals receive a much larger amount of money, both overall and in the first year. They get $21,250 in the first year, and then $8,500 for up to 5 years after that. And they get the full amount even if they qualify as late as 2016. The payment for eligible hospitals is a little more complex and depends on whether the funding comes through Medicare or Medicaid, the hospital type, and the share of patients in Medicare or Medicaid. One controversial aspect to this rule was that multi-campus hospitals were counted as if they were a single hospital. An overview of the general formula for payments is listed here. There is a base amount of $2 million for an eligible hospital, and then an incremental amount of money per discharge, starting at the 1,150th patient for a given year, up to 23,000 patients. This means that the maximum for 21,850 discharges would be $2 million for the base and $4.37 million, resulting in a maximum payment of $6.37 million. The money is then multiplied by the Medicaid or Medicare share that the hospital has. There is also a transition factor, with the full amount being paid in the first year, 3/4 in the second year, half in the third year, and a quarter in the fourth year. Payment starts when the hospital becomes eligible, with no penalty for starting later. Another aspect of the rules for meaningful use was the connection of the rules from the Centers for Medicare and Medicaid Services, or CMS, as the payment entity, and the Office of the National Coordinator, or ONC, as the standard setter. The HITECH Act tied standards to implementation specifications and certification criteria adopted in the ONC rules to the incentives under the CMS rules by requiring meaningful use of certified EHR technology. The required standards from ONC are in the areas of vocabulary, content exchange, transporting of information, and privacy and security. Recall that to be eligible for meaningful use funding, use of certified EHRs is required. A more detailed description of the ONC Health IT Certification Program is available on the healthit.gov website and includes a list of certified EHR products. The complete links can be found in the References section of this lecture. The EHR certification process starts with the vendors that create the EHR products that meet the standards and certification criteria adopted by the Secretary of Health and Human Services. There are then the accredited testing and certification bodies that test and then certify EHR products based on the ONC standards. The ONC then posts the list of certified EHR products to their Certified Health IT product list. Finally, eligible professionals and eligible hospitals use the EHR products in accordance with the meaningful use objectives and measures, attest to that, and collect their incentive payments from CMS. The EHR certification process actually requires two steps: the testing of the system and then the actual certification. There is a firewall between the testing process and the certification process, but when that process is completed, the product is posted to the Certified Health IT product list. The detailed test procedures for EHR certification are also listed on the ONC website. They are organized around each of the meaningful use criteria. The complete web link is listed in the References section of this lecture. How does an organization get the meaningful use money? It has to meet and report on the meaningful use criteria. There's actually one exception under Medicaid. In the first year of Medicaid funding, an eligible professional or eligible hospital can demonstrate that they adopted, implemented, or upgraded a certified EHR, so they don't necessarily need to meet all the meaningful use criteria. In that first year, as long as they've either adopted, implemented, or upgraded to a certified system, they will get the incentive dollars. Medicaid also allows for opting out of or skipping years, but the adopting, implementing, or upgrading process must start by 2016. The link on this slide provides more detailed information on obtaining the funding from CMS. How much is this all going to cost? Remember that this was part of the economic stimulus package, so the goal was to actually spend the money. The total cost of the program will depend on how many eligible professionals and eligible hospitals achieve meaningful use. When the program was initially launched, CMS made estimates of eligible professionals and eligible hospitals and made calculations based on how many would achieve meaningful use and be eligible for the funding. CMS estimated there were about 477,500 eligible professionals under Medicare, with 95,500 of those also eligible under Medicaid, and another 44,100 eligible professionals under Medicaid only. CMS estimated that there would be slightly over 5,000 eligible hospitals, most of them acute care, but some number of them critical access hospitals, and a much smaller number children's and cancer hospitals. CMS then made some calculations based on low and high estimated achievement of meaningful use in 10 years. Low achievement was defined to be 95.6% of eligible hospitals and 36% of eligible professionals, with high achievement being all eligible hospitals and 70% of eligible professionals. For low achievement, the program would cost $9.7 billion. For high achievement, it would cost $27.4 billion. That's where the figure of $27 billion spent on the HITECH Act over its lifetime comes from. We will see in subsequent lectures that the number has actually exceeded that figure. This concludes Lecture A of the unit on meaningful use. In summarizing this lecture, the goal of the HITECH Act is to provide incentives for the adoption of EHRs by eligible professionals and hospitals. Eligibility for HITECH Act incentives is provided by meeting the criteria for meaningful use through the use of a certified EHR. and the criteria for meaningful use are met in 3 stages.